Hello and welcome back. Since you clicked on this video, you probably know that I will be discussing diabetes. But first, we have to understand the normal state of our body. The normal state is when we eat food and that food is broken down our stomach into glucose and other substances. By the way, glucose is a type of sugar that our cells need for energy. And there's other thing that we have to know, which is insulin. Insulin is a hormone that pancreas releases to decrease sugar level in the bloodstream. So, to understand diabetes deeply, you can think of it as a door into cells, and the glucose stay in blood, waiting insulin until open the door to enter the cell and transform into energy. Like in summary, food, glucose, insulin, energy. Again, food, glucose, insulin, energy. That's it. Now let's discuss diabetes. There are two main types, type 1 and type 2. In type 1 diabetes, the pancreas cannot release insulin at all. As a result of that, the glucose remains in the bloodstream, of course, because there is no one open the door, which is insulin. That causes, the sugar level to rise. But in type 2 diabetes, the pancreas release insulin. But insulin cannot work effectively because of fat deposit on the door. Here, two things will rise in the bloodstream: glucose and insulin. So now let's see the treatment. In type 1 diabetes is usually diagnosed in childhood and in people under 40s, and it requires daily insulin injections or the use of an insulin pump to manage blood sugar levels. On the other hand, type 2 diabetes is typically diagnosed in people over 40s, and the treatment requires and involves lifestyle changes such as exercises, diet modifications, as well as oral medications or insulin therapy. According to the International Diabetes Federations, as of 2021, approximately 10% of all people with diabetes worldwide have type 1 diabetes, while the remaining 90% have type 2 diabetes. However, the percentages may vary based on region, age group, and other factors. Regardless of the type of diabetes, it's important for people with the condition to monitor their blood sugar levels and follow a treatment plan prescribed by their healthcare providers. With a proper management, people with diabetes can live long and healthy lives.